We're so excited because just this past Wednesday, we were informed by HRSA that we are one of the 3 community health centers in Minnesota to be awarded a grant to be able to continue to do the work that we do, that we've done for 70 years, to help people have more access to primary care. The support we've gotten from people across the community has been amazing, and yours has been unfailing for all the times we've tried, and here we are.
Because people who don't have access to health care, who can't keep their medication going, who have a chronic condition, land up in the emergency ward. Bad for the patient, bad for all of us, because it makes insurance rates go up, and it just makes health insurance more expensive for everyone. So this is the right thing to do, to have community health care clinics. And I'm so excited that the Affordable Care Act has a real strong focus and emphasis on community clinics, where so many Americans, but here in Minnesota, a lot of people get their health care.
Absolutely.
And so tell us more about the grant. I'm so excited about it.
We are too. This grant will allow us to be able to care for more patients who have no insurance. But top of our list is, when we built this building, we were able to raise enough money to start a dental clinic. I don't know if you know this, but the last article I found is that it's somewhere around 13% of persons who come to the emergency room come for untreated dental care.
That's correct.
People who have no insurance, they might be at risk. If you have diabetes, you have more risk for dental concerns. So what's interesting about that is our patients will be able to have full service health care. We already have mental health services, which we can expand. We've started to expand our services down the street at Sibley Manor Clinic, which is in the shopping center across from low-income housing. People can walk across the street. It's a mini version of this beautiful place. So it's about serving more patients, and we have committed to the federal government that over the course of this 3-year grant period, we will serve a minimum of 4,000 new patients. And so we're excited.
We're excited about the grant, but here's the but.
Right.
If the Supreme Court on Thursday strikes down the entire Affordable Care Act, this access in our community for people who are underinsured,
Yes.
have insurance that doesn't cover everything, or don't have access to insurance through no fault of their own, that money disappears. This grant disappears to provide more access to health care, especially dental. And if they strike the whole thing down, parents now who have their children on their health insurance, age 26 and under, we're going to see insurance companies not do the coverage on that. We've had some insurance companies stand up and say that they'll continue that coverage, but a majority of them won't. We're also going to see, if the Supreme Court strikes everything down, people bump up against lifetime caps. People who have diabetes, chronic diseases, cancer, all of a sudden find themselves in bankruptcy even though they had health insurance. And we're going to see people like yourself who had a pre-existing condition continue to be denied health care. And diabetes is a pre-existing condition, but is a very common condition in our communities. So we'll stay tuned and see what happens on Thursday. But I wake up every morning optimistic. The sun's out shining. This is a fabulous community health clinic here at United, and I'm looking forward to going up and meeting with the doctors and hearing from the patients and seeing the dental clinic. That's going to be in action shortly. So congratulations.
Thank you so much.
I'm so happy for all of you.
So much.
For all of us.
Yes.
For all of us,
So
for the community.
You know, one of the reasons I came to United Family Medicine was because I thought I'd be able to get insurance, and I wasn't able to get insurance because I'm diabetic. But I had always had insurance, so I didn't know that the pre-existing condition would cause me to not be able to get access to care. So what happened was I couldn't get access to health care because I was denied by all of the private insurance companies. And I'm a lawyer, I'm highly educated, I take care of my health, but it didn't matter because of the fact that I could not get health insurance. So I went for 3 months without having any medication. I couldn't get my insulin, I couldn't get my heart medicine or anything. And so somebody told me about United Family Medicine and said, you should go here, they don't care if you have insurance. And so I called and I said, can I get in? I don't have insurance, I don't have access to insurance. And they said, sure. And, at the time, I was super stressed. It really, really affected my family. I'm a single mother. I have 2 kids. My youngest son is autistic. So the fact that I can't get access to care meant he can't get access to care. And so what happened was I came here and I got to see Dr. Booker here, but it literally changed my life because if you're diabetic, you can't go without your insulin. It's like you can have all these other issues. I was trying to control it with my diet, but it didn't matter. And so when I finally got here, I was able to get access to care. They helped me to get my medication at a reasonable price so that I could afford to have medication and to begin taking care of myself again so I could take care of my family. So it's so important because I've worked every day of my life hard, but if you have a pre-existing condition, it doesn't matter what you do. So it really changed my life, and I'm dedicated to this clinic and community clinics throughout because being an African American woman, I'm predisposed to a lot of different diseases, and without access to care, I can't take care of my family, and there's many other African Americans. I'm sure you know about the healthcare disparities with African Americans having access to care, getting the right care with respect. So it's an amazing, amazing clinic, but without the Affordable Care Act, without clinics like this, people like me can't have access to care, and it can change their lives.
Okay.